Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please uh, give your valuable comments. And you can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. So it is quite convenient for continuous study. And my dear friends, as we know, so we were discussing about some of the important issues related to vaccination that we face in the OPD level. So today also we will have another important case. See, this is a 16-year-old male adolescent who visited your OPD with sustaining a road traffic accident injury. Okay, he met with a road traffic accident, maybe minor, and he is coming to your OPD, and his concern is about the TT, whether you have to take the TT, tetanus toxoid injection, or not. And what he says is he has taken TT, now he is 16-year-old, so he has taken TT injection 10 years ago. Previous vaccination is about 10 years ago. And he is also telling that he has also taken all the primary DPT doses, and he has also taken all the booster doses related to DPT. Now the question is, at this particular juncture, whether he need a tetra dose, another dose, whether it is required. Okay, so this is the question. A 16-year-old male adolescent is coming to you with a road traffic accident, and previously about 6 years back he has taken the TT vaccine, and he has completed all the primary and booster doses of DPT. Now what will be your answer? Now again, a dose of DPT is not required in this case, okay, as he has already taken all the 3 doses of primary doses of DPT and also the booster doses. Again, another dose of DPT is not at all required here, and what is required in this particular case is only a TT, simple a TT, 1 dose TT is sufficient. Because the reason is very simple, as he has taken all the primary doses of DPT in the childhood period and also the booster doses, his body immune system is already sensitized against this particular tetanus. Okay, so just to boost up the titer level, 1 single dose of only TT, individual TT injection is sufficient. There is no requirement of any DPT or not requirement of any Tdap, etc. So just 1 dose of TT is sufficient to protect him. So very simple. This is a quite simple case. Of course, often we come across with such problems. That's important. But again, what we have to understand is the approach will going to change if he has not taken the DPT vaccine in the childhood period, or he has not taken some other the booster doses. In that time we have to think in a different way, which we have discussed in the last class. But in this case, a single dose of TT is sufficient. So this is case number 1 for today. Now we will have another important case number 2. Case number 7 in the series. Now, what is this? A 2.5-month-old female baby is coming with the swelling in the axillary lymph nodes. So mother is bringing her child, 2.5-month-old female baby, and mother's concern is mother is observing that since last 2 days a child is touching that particular axillary lymph node part frequently, and when mother sees there is a swelling, now she is worried and she is coming to you. And by looking at the case, 2.5-month-old baby, probably at the time of the birth the baby has been given with the BCG vaccine, and one of the most known complication of BCG vaccine is BCG adenitis. So this is also a case of BCG adenitis. What is BCG adenitis? Sometime after giving the BCG vaccine, so there will be stimulation of these lymph nodes, especially the clavicular, especially the cervical and as well as posterior cervical and as well as this axillary lymph nodes. Okay, So because usually we know that BCG is one such vaccine which actually imparts the cell mediated immunity, and lymph nodes plays a very important role in cell mediated immunity, we know that. So whenever we give the BCG vaccine, it is the lymph nodes which initially uptake this vaccine, and some reaction and proliferation etc. will going to take place there. Unfortunately, what happens sometimes is there will be over proliferation in the lymph nodes, and the cervical lymph nodes and as well as the axillary lymph nodes will go into enlarge, and there will be painful enlargement with the redness sometime, and this is called as BCG adenitis, which is one of the most common complication of a BCG vaccine. Now, yes, is this is a case of BCG adenitis? Yes, this is a case of BCG adenitis, because a 2.5-month-old baby, almost 2.5 months over after birth, at the time of the birth the BCG has been given, now it is 2.5 months. So usually what we say Cox phenomena which happens, so that will going to end by 10th week. Now 2.5 means almost all we have completed. 2.5 means almost 8 weeks has been completed. By this time there should be a formation of the scar, or a process of scar formation should be on the peak, but unfortunately in this baby, instead of that, so we have got painful enlargement of the cervical and as well as axillary lymph nodes, and definitely this will be grouped under BCG adenitis. Now the next question mother asks you, who is responsible for this? Okay, what is the cause? Is this a fault from my side? Is this a fault from the doctor's side, or some other technical problems? This is another important question faced. So now actually the answer is nobody is responsible for this, because BCG adenitis is quite common complication of a BCG vaccine. Nobody is responsible, because it depends upon many things. Okay, it depends upon the host defense, because each kid's host defense is different. Okay, sometimes the host defense is very exaggerative, and sometimes the host defense is normal, sometimes the host defense is modified. It depends upon the host immunity, and not basically it is because of any other fault. Okay, this can happen to any baby. Unfortunately in some of the babies this do happens. Okay, so this is one, but sometime it is maybe iatrogenic also. Sometime if the vaccine administration has been not done properly, maybe you are giving IM, okay, instead of intradermal IM, or dose calculation was mistaken, and that means don't calculate a dose, the given dose is more, that may lead to such type of problem. So in majority of the time nobody is responsible for that if it is given by a trained doctor, but sometime iatrogenic causes may lead to this can happen sometimes because of iatrogenic causes. Anyway, when BCG adenitis occur, what we have to do? So you should not be in worry or hurry, and you should not be get panic in that time. What you have to do is just wait and watch policy. Now axillary lymph nodes are get enlarged, they are also painful. Just wait and watch policy you have to adopt. If the enlargement is very mild, if it is a small lymph nodes, axillary lymph nodes are enlarged, little painful also, but not too much, then there is no role of any of the drugs, anti-tubercular drugs or antibiotics, etc. No, if it is very small, just go for one anti-inflammatory drug for 1 or 2 days, so that may get subside and the case is over. But sometime unfortunately the swelling may be quite larger and maybe more painful, and even sometimes it may be pus filled, lymph node may be pus filled or fluid filled. So that time we need to go for the draining. We have to go for the draining, and if it is too big, causing much more problem, then unfortunately we have to go for excision also. In that time we have to also go for one prophylactic anti-tubercular drugs also, maybe the rifampicin, etc., to prevent the future complication. This do occur in some of the babies, and actually if it is given by a trained doctor, nobody is responsible for this. This totally depends upon the host immunity factor. Okay, so this point we have to be very, very clear. And so this is all for today. In the next class, we will discuss one more important case related to vaccination. Thank you very much.